Welcome viewers, this is your host Nurse Roslyn Odhiambo on Skills versus the Midwife, and today we are going to have a video that completes the section of the patogram. We started with discussing the part 1, part 2, and now we are completing the rest of the parts, and this is the part that we are going to discuss on the drugs and the fluids, and to include some of the lab tests that we carry out that is very important for mothers in labor, that is urinalysis. So we can look back on our charts as we discuss. So when you look at this patogram once again, viewers, when you look at this patogram, we can see this section here that is written drugs given and IV fluids. Drugs given and IV fluids. Now this section is important for us because at some point during management of these women in labor, we may have the need to manage them using different drugs or additional drugs. So in this section, we are only inputting or indicating any additional drugs that have been used to manage this woman during labor. Remember the other discussion we had, remember we talked about oxytocin. Now this is will be used to manage this woman in case we have problems or issues with their contractions if they are not strong enough. But if there are any other drugs or fluids that have been administered, then we will have to indicate in this section here. For example, we can give normal saline to manage conditions like fetal distress. We can also use other drugs maybe for pain relief. So any drug that we give, we indicate here. Any additional drugs we indicate here, and that also depends on the time that you gave it. Then it will guide the next person who is managing this client who is in labor. Okay, I hope we are together. Then on this last section here, remember we are finalizing on our patogram. We've been able to discuss all the other parameters. We have this section here where we are having urine, and the urine has different parameters where we are checking the protein, the acetone, and the volume. And whenever we perform urinalysis, which is normally done every 2 hours, urinalysis is normally done every 2 hours, therefore we'll indicate the findings down here. Now when you talk about protein, if we test the urine and we realize that there is protein, then it could be an indicator that this woman could be having some of the hypertensive disorders, including preeclampsia, eclampsia, or any other to that matter. And if we have acetone, acetone is a very major indicator of a client who is having dehydration, and therefore this client has set in ketosis probably, and this is simply because during labor the clients expend a lot of energy during that process, and therefore with depletion of the energy stores, then we end up having conditions like ketosis that indicates that this woman is dehydrated. And as pertain to volume, we normally check the volume. So when we take the urine, we also measure the volume so that we can be able to elicit if this woman is also becoming or having oliguria. Now oliguria is a major indicator of poor renal function, and therefore we can take action immediately and see what decision we can make to take care of them scanty urine that is being produced. Otherwise, as pertaining how to chart, like I said, we take urinalysis every 2 hours. For protein, if protein is present, then you can have it ticked like that. You can tick to show that protein is present. And we say if it is 2 hours, then if we have ticked in this box, then you count. This is the first box. And we said one big box. Remember we said one small box is 30 minutes and one big box is actually 1 hour. All right, one small box is 30 minutes and one big box is 1 hour. So you can skip. So this is the first box, the second box, and then you can indicate the next one. So if it is present, you can tick, or you can just indicate a plus. Then if we have acetone, then you can tick also or indicate that it is positive. For the volume, indicate the exact amount. For example, if it is 150 ml, just indicate 150 ml. And therefore, this will help us to manage this woman in a much better way. So this is the last part. This is the last bit that we had. So let's meet next in the next video. Let's meet in the next video to discuss more on how to chart. We are going to literally chart the patogram. Thank you.